is Kirsten Vinsickle. I'm an advanced EMT with Pender EMS, and today I'm going to teach you how to properly use an iGel airway during an airway emergency. First off, what is an iGel? An iGel is a supraglottic airway placed in the patient's throat that delivers oxygen directly to the lungs. It is used in place of a standard bag valve mask. Now, why would we want to use an iGel versus a BVM? Well, an iGel stays in place at all times and it limits the amount of hands-off time during compressions if used in a cardiac arrest. It also is very useful for patients where you may not be able to get a good seal with the mask. So how do we size iGels? So iGels are sized based off of ideal patient body weight. My organization offers 5 of the 7 sizes. So size 1 is going to be for your neonates and infants. 2 is for small pediatrics. 3 for large pediatrics and small adults. 4, which is the one I'm going to use on this mannequin, is for your average size adults. 5 is for large adults. Now remember, I said it is based on ideal patient body weight. Just because a patient is heavier doesn't necessarily mean you need to size up on your iGel. Before you start, make sure you have everything you're going to need to insert the iGel. That includes the iGel itself, the strap or medical tape, lube, your bag valve mask, capnography, suction, and oxygen. The first step is going to be making sure that your patient doesn't have a gag reflex. As funny as it sounds, the easiest way to do that is to poke them in the eye. If they don't move their eye or blink, that means they don't have a gag reflex. Make sure you check, because if you go to insert an iGel in a patient with a gag reflex, number 1, it's going to get quite messy, and number 2, it's going to put your patient in danger of aspirating. The second step is going to be preparing the iGel. To do that, we want to grab our iGel and our lube, and you're going to open up your lube packet and spread it on the cradle here. Then take your iGel and you're going to rub all the surfaces of it to get it all nice and slick so that it is very easy to insert it. Next, you're going to make sure that your patient's airway is clear. We're going to do, if it is not, it's going to need some suctioning. So you'll plug your Yonker into either your truck's suction or portable suction device. You'll take the tip of the Yonker, insert it into the patient's mouth, place your finger over the hole, and sweep side to side while pulling out of the patient's mouth. We don't want to suction for longer than 10 to 15 seconds because that will deoxygenate your patient. Once the airway is clear, you can go ahead and start thinking about inserting the iGel. So you're going to position yourself at the patient's head. You're going to grab your BVM with your capnography. Now we want to make sure we are pre-oxygenating our patient. What does that mean? That means we're going to give them a few quick breaths with the BVM to give them oxygen in their system and we are doing the procedure. So you'll take your C-grip on your mask, place it over the patient's mouth and nose, and do your head tilt chin lift while placing firm pressure on the patient's face. Take your right hand with your E-grip and you're going to squeeze gently until your bag is about halfway full. You want to make sure that your bag valve mask is hooked up to oxygen flowing at 15 liters per minute. Next, you're going to grab your eye gel. You're going to keep the patient's head in a sniffing position and using your thumb, press down on the patient's chin while inserting the tip of the eye gel into the patient's mouth. You're going to continue following down the patient's hard palate until you meet firm resistance. Now you know your eye gel is placed properly when the black line on the eye gel is even with the patient's teeth. As funny as it's going to sound, especially since we all know what these eye gels look like, per the manufacturer's instructions, if you're having a hard time advancing it, you're going to give it a little wiggle wiggle, push push. If you're still having a hard time, you can remove the eye gel, add some more lube to it, and attempt to reinsert. And if you're still having a hard time, especially with initial insertion, a twist into place may be required. Otherwise, you may just be using too big of an eye gel, and you may need to size down. Once you have your eye gel in place, you're going to disconnect your mask from your bag valve. Take your capnography, plug in your capnography. This end is going to plug into your monitor, and you're going to fasten it to the eye gel. You'll now need to reassess or assess your lung sounds. Now you can either give the BVM to your partner, firefighter, police officer, or anyone on scene that you can teach how to gently squeeze the bag. You're going to have them squeeze the bag while you assess lung sounds in all four fields. If your lung sounds are present, you're good to start fastening and securing your eye gel. If you do not hear lung sounds, you may not be in far enough. You may just have to advance the eye gel slightly further. To secure your eye gel, you're going to take your strap, place it underneath the patient's head, and pulling tightly, you're going to place it on the hooks that are on the eye gel. Once you have it secured, you're going to go ahead and reassess your lung sounds. As you can see on the mannequin, I still have good return with it. Now, what happens if you lose the strap, it breaks, or for your pediatric patients where it's not going to fit? That is where your medical tape comes in. You can take a nice long strip of tape and place it about where the number is. Take one side and you're going to firmly place it on the patient's left cheek. Take this strip and firmly place it on the patient's right cheek. That crisscrossing of the tape is going to give you that downward pressure that the strap provides for it. And you do the same thing, check and assess for your lung sounds. Now, we want to make sure that when we're bagging our patient, especially in patients that we have ROSC on, we're monitoring our end tidal capnography. Now, the ideal range is between 35 and 45 millimeters of mercury. If you find that it is below 35, you're bagging too fast, so slow it down. If it is above 45, bag a little faster. You want to continue bagging your patient every 6 seconds. You're going to want to check the placement of your eye gel and reassess lung sounds every time you move your patient and throughout transport. We've all been in the back of an ambulance. We know that it is not a smooth ride, so there are lots of chances for that eye gel to come loose. The biggest piece of advice I can give you for using one of these devices is to remain calm. Cardiac arrests are especially hectic environments, and they're also very, very low frequency. We don't experience a whole lot of them, so remaining calm is going to be the biggest key to being able to use one of these devices properly. I hope this video helped you, and have a safe and good shift.